Hello, darlings. You've all heard of Marilyn Monroe. Some of you know Bridget Bardot. Well, now it's time for the Cognac Show. Limousines drinking the finest champagne, wearing furs, dazzling diamond jewelry. A girl can't complain. I live the upscale life, dining in the finest restaurants, eating the best caviar for free. And no matter how much I enjoy myself, they can't.
Volume, and they're really good, safe, effective ways of plumping the lips, if you will, in a relatively natural way, because you're replacing like with like. These are proteins that are really designed to be exactly the same compound that our bodies lose. And this is really the advance that we're at today with plastic surgery. And it's really fascinating to us because, you know, again, in the past, it really was just surgery that took care of everything. Now it's surgery that's really moving towards minimally invasive, and I'll get to that in a minute. But it's also stuff that we can basically apply to the body, again, in the most minimally invasive form, to rejuvenate someone, give them minimal, if any, downtime, maximal results, and it even keeps costs down as well. So, and as far as surgery is concerned, really the most recent trends are just to minimize the approaches. You know, surgery is usually a bad word. When someone needs surgery, everyone's concerned. And, you know, incisions, which is our approach in surgery we make with the scalpel to get access to the area we need to fix, used to be fairly sizable. We're really trying to minimize the approach to any type of surgical procedure. We still get maximal results through smaller incisions, and we're even moving on to better technologies like endoscopic type of procedures where we can actually make a tiny little incision, put a camera in there, make strategic other very small incisions, put special instruments into the area that we need to fix, and accomplish what we need to accomplish. So hopefully as time goes on, you know, plastic surgery will continue to evolve this way. And again, it's all about safety, it's all about effectiveness, it's all about people being happy in the end. This is elective surgery. This isn't surgery that is required to correct some horrible disease or something like that. It's just something that we've really been able to fortunately significantly develop over the last 30, 40 years to just improve everyone's quality of life.
The chemistry of surgery has come of age. And over the last maybe 10 or 15 years, what has happened is the merging of surgery with these other things that we do that are kind of invasive because you're using needles and stuff, but they're not really as invasive as using a scalpel. And what the new trend now is to take both of these things and merge them together. And so let's say, for example, you take somebody that needs a facelift, but they waited a little bit too long to look really natural. So by doing a modified facelift and putting the muscles back where they belong, redraping the skin over those muscles, and then later on filling in these little marionette lines, which are very difficult to get rid of with surgery, giving them back their plump lips that they had when they were younger. Now you've taken these two modalities, you put them together, and you've come out with more than 1 + 1 = 2. And you've done it essentially with less risk. Because nowadays, we can stop bleeding, so we can operate on a person without losing a lot of blood. And that was the bad thing about surgery, is that you cut, you bleed, and now your body has to remake that blood. That's what makes you feel bad. So by making smaller incisions, by controlling the bleeding, we now move from the art of the surgeon, okay, actually the science of the surgeon, to the art of the plastic surgeon, where now you can actually sculpt things that you weren't able to do before because you're not concentrating on, do I have to stop bleeding or this and that. You're concentrating on what is it that I'm going to do here to take this canvas and make it look nicer. And I think that's why plastic surgery, cosmetic surgery in particular, has become very popular.
We were asked by ABC to address two issues. Number one, what was the most common procedures that are requested? And number two is, what are the most common body parts that are requested by patients that resemble celebrities the most? For example, Kim Kardashian's butt, Angelina Jolie's lips. And, you know, this really isn't anything that we found, you know, through any study or what have you. This is really just anecdotal type of facts that we get from our own patients in our practice, you know, just from our colleagues, just from the community in general. You know, I'm not really a fan. I'm pretty much can probably speak for both of us. I mean, when someone comes in asking to look like a celebrity, it kind of puts up a little bit of a red flag. I mean, you know, you are who you are. you're not really, we're certainly not in the business of trying to make you look like someone else. We just want to take the best out of you and make you, bring you to your full potential and just go.
Welcome back to Cognac's Corner. I'm surgeon. He's a world-renowned plastic surgeon. Introduce yourself to the camera, darling.
Hi, thanks, Cognac. I'm Dr. Matthew Bonanno. I'm a board-certified plastic surgeon here in Manhattan.
Tell my audience, now you spoke here tonight about all the wonderful things that plastic surgery can really do for an individual. Of course, many people are unsure about having plastic surgery, and you talked about basically how they should be at ease and should really focus on what their problems, their issues are in plastic surgery. Tell my audience, what should they, if a person is really thinking about having plastic surgery, what are the questions they should ask themselves?
Well, I mean, let me start out by saying that plastic surgery really is safe and effective these days. I know plastic surgery certainly gets a lot of bad press in the media, but the truth is that the vast majority of cases are safe, they're effective, patients are happy, makes the surgeon happy, and that's really what it's all about. It's really to improve quality of life. I mean, we're not talking about surgery that's life-saving or what have you. This is surgery really just to improve someone's quality of life, to improve their appearance, and just to, make them happier. So when you're going to see a plastic surgeon, you want to make sure that they have the proper credentials, that they are a board-certified plastic surgeon, they have the proper training, so that when ultimately you have your procedure done, that you know it's going to be done properly. The other thing is to educate yourself before you go to see your plastic surgeon. Find out.
That's basically what I want to know. I think everyone out there should really focus on educating themselves. What's important when I go to a plastic surgeon? What are the following questions I should ask the doctor? What is the recovery time? How long is the procedure going to take? All these is there any therapy involved? I mean, these are important issues that everyone wants to know when they do decide to have plastic surgery.
Absolutely, I agree, Cognac. I mean, the American Society of Plastic Surgeons has a great website. And a patient can go to the American Society of Plastic Surgeons website and find out about the procedure that will be performed in the area that they're concerned with. And it will give them a breakdown of the procedure, a breakdown of the problem itself, and really actually guide them what questions to ask their plastic surgeon so that they're fully informed at the time of initial consultation. And all the questions you had just asked will actually be described clearly by the plastic surgeon at that time. But any other questions that the patient may have that they may pick up from that, from a website such as the American Society of Plastic Surgeons website, would be a good first start.
And lastly, if they do want to get in touch with you and they do want to come to you as a medical practitioner and as a very famous plastic surgeon, where can they go to find out about what you can do for them and how you can help them on the internet?
We have a website, www.drbonanno.com. Our office is located on the Upper East Side of Manhattan. We're at 215 East 77th Street. And our office number is 212-570-6411. And we'd be more than happy to answer anyone's questions regarding plastic surgery.
Fabulous. Well, I want to thank you, Doctor, for taking the time out to talk to us here at cognacscorner.tv, this wonderful event that was promoted by Adam Kluger. Are you going to give me a kiss goodbye, darling?
Absolutely. Thank you so much.
And we'll be back in a moment, darlings, with more celebrity interviews. Keep watching. Pink Champagne Kisses.
Oh, I said cognac, ooh, ooh. I said cognac, ooh, ooh, ooh. I'm a bubbly blonde, fancy dress to impress. One of a kind girl. This has been a Crybaby Productions, darlings.